So I've got a few prepared remarks, and then we'll get started with this armchair discussion. So welcome to this career development armchair discussion. We designed this as an informal and inviting way to learn key strategies for career development. So our panelists today are Drs. Brita Roy, Jada Bussey-Jones, Suzanne Fletcher, and Bob Fletcher. I suspect most of you know each of our distinguished panelists, but I'm going to give a brief background about each. So Dr. Roy is an assistant professor at Yale University School of Medicine and director of population health for the Yale Medical Group. She is committed to helping patients from all backgrounds live meaningful, productive, high-quality lives. As such, she is beginning her career as a clinician investigator and program developer focused on understanding and improving the social and environmental context of healthcare, especially for those of minority backgrounds and low socioeconomic status. She is also engaged in medical education at the undergraduate and graduate levels, teaching clinical skills and the social determinants of health. Dr. Bussey-Jones is a professor of medicine at Emory University School of Medicine. She is chief of the Grady Section of General Medicine and Geriatrics and co-director of the Emory University's Urban Health Initiative. She is passionate about medical education and interventions to improve health equity and primary care of the underserved. Dr. Suzanne Fletcher is Professor Emerita in the Department of Population Health at Harvard Medical School. She met her husband Bob during their first year of medical school 54 years ago. The Fletchers have two sons, one of whom is a hospitalist and co-author of the 5th edition of a textbook on clinical epidemiology that his parents began writing when he was 10 years old. Suzanne has been active in SGIM since its formation and was president 33 years ago. Now, Bob was president 24 years ago. A constant challenge over all those years was and is how to use time better, a topic Suzanne will discuss today. And last but not least, Dr. Bob Fletcher is Professor Emeritus in the Department of Population Medicine at Harvard Medical School. Bob and Suzanne married for love and to build a home life together, but soon began to collaborate at work. Lab partners were assigned alphabetically, so they learned to draw blood and place NG tubes on each other.
Oh my gosh.
With time, collaboration included division chiefs, co-editing the Journal of General Internal Medicine and the Annals of Internal Medicine, co-directing an international program, and writing 5 editions of a textbook on clinical epidemiology. Theirs is one of many out-of-the-ordinary arrangements represented here today and was lived in a different time, but the challenges and menu of solutions are timeless. So I want to thank the panelists for preparing their index card advice for career development, copies of which are on your table and are also available on the SGIM website. So that's this here. You can see this on your table. Each of the panelists provided 5 key strategies for career advancement, and they are placed on a little card, sort of an index card. So I borrowed this from Harold Pollack at the University of Chicago. You may have heard he did this for personal finance, wrote a book, and has been very successful with his index card approach to personal finance. So if he can do it for that, we can do it for career advancement. So take a look on your table for this. So I would encourage everyone, particularly fellows and junior faculty, to look at these note cards which highlight proven strategies for career success. This is an informal question and answer session, and I would encourage attendees to ask questions of our panelists. Jeff Linder, Mark Wieland, Andrea Christopher, Emily Mullen, Ryan Nolan, Sarah Fazio have agreed to serve as facilitators with microphones. So they should be standing around, spread throughout the crowd here. So please raise your hand if you have a question, and they will come to you with a microphone. So before we begin with a question and answer, I'd like to ask each panelist to highlight one or two key strategies they have taken to reach their current position. So I think we'll start with Brita. Brita, if you could share that.
Sure. I guess one of the strategies I think I put on the card was to be honest. And really being honest means being honest with yourself, which requires a lot of introspection. And I found that the times that I was able to do that best, or be most deeply introspective, was actually in times of failure. It was really during those times that I had to look really deep within myself and think about what's really important to me and why. And once I figured that out, getting help. So having a diverse array of mentors and people that you can turn to and tell them what you want to do and why you want to do it and why you're interested in it. And they can help. If they themselves are not able to help, they can usually connect you to other people that can. And so that would be my quick advice.
Thank you. Jada?
So first of all, I want to thank you for inviting me in the program, Chair, for this innovative way to sort of reach the entire community, which I love so much. As I was reflecting on this first couple of minutes that we might have, I wanted to share a story that some people from my institution may have heard probably too many times. It's the story of my grandparents who lived in a small rural Georgia town that had a railroad track that I described to my learners was both a physical and metaphorical divide between races. So blacks on one side, whites on the other. And my experience is every summer that I went back to stay with my grandparents until I was about the age of 11 in that small town, and the discussions that we had around the dinner table really, I think, define and sort of set the vision, color the lens through which I see the world, and really define for today's discussion sort of my career choices over time. And while my grandparents, they achieved as much education as they could in that small town, which was about a grade school education. On that side of the railroad tracks, the black school only went to about 7th or 8th grade. My parents were able to attend high school, and my brother and I were first-generation college graduates. That I was met a lot when I first entered the steps of Emory University and later the School of Medicine at Emory with, I think, lots of fear and self-doubt, probably perhaps because I was a first-generation college graduate, perhaps as a female, perhaps as a person of color, but I found myself asking the questions like, am I really supposed to be here? Do I deserve to be here? Can I do it? And though I had those issues with confidence, and if I'm honest with myself, I still ask those questions sometimes even today. But the one thing that has remained constant was the very thing that started in that small town, in the 2-bedroom house without running water, which was a commitment to serve the underserved and to work with communities that are very similar to the ones that my grandparents grew up in and I spent much of my formative years. And so if I could give any advice from a career perspective, it's finding your purpose and having a passion and commitment.
Thank you. So, Suzanne?
I want to ask a question. Would you raise your hand if you had already graduated from medical school 33 years ago? All right. This is an example. If you're looking around, there are not a lot of hands that are going up. As Chris mentioned, I was president of this organization before most of you graduated from medical school. And what I love about this organization is that today there's the same incredible commitment to helping others and to have an experience of incredible, along with that helping others, that heart is this incredible opportunity to keep growing intellectually and to keep being challenged intellectually. And finally, to do it with such fabulous other people. That, to me, is what SGIM is all about. I don't know how SGIM has maintained this approach over 40 years. It's incredible. I think a major reason it's maintained it is because so few of you put up your hands, and there's so many new people coming in all the time to re-energize this wonderful, wonderful society. When Chris asked if Bob and I would participate in this, I said, Chris, I think I'm out of date. But in one way, at least one way, I'm not out of date, because almost everyone says, I have too little time. And frankly, we've invented so much, but there's still only 24 hours in a day. So I wanted to spend a little time discussing how to manage time better. And if you look at the card, one of the things I suggested is Covey's approach. And if you don't know about Covey, Stephen Covey wrote a book called 7 Habits of Highly Effective People back in 1989. It was for the business world. Someone told me to take a look at it, and one piece of it that I just thought was terrific is he got down to the daily activities of how we spend our time. And he basically said we spend it either on important or unimportant things, and urgent and unurgent things. A 2x2 table. Well, we all know 2x2 tables, so I guess that's why I liked it so much. But he said highly effective people spend more time on important, non-urgent activities. He didn't specify how much more time, but he gave some examples. And I figure he really thought that 15 to 20% of our daily activities should be spent at least that much in that category. And if you can do it, you're highly effective. And so just thinking that way helped change the way I spent my time. That I'd look at this big daily list of activities I was supposed to do, and I'd say, how many of these are actually important and non-urgent activities? That tends to be the planning, the thinking, the preventing things that shouldn't happen, the things that we keep talking about at this meeting. How do we translate that into our daily activities? And of course, your highest priority is whatever your real passion is. And to try and get that into daily life, I thought, helped me. You may have some other thoughts as well, but if you haven't looked at Covey, you might enjoy getting out that or kindling it or whatever. It's one of the very few organizational books that I've ever looked at that I thought was worth my time. Thank you.
Thank you. So, Bob?
So we're sharing here with you today really a menu of possibilities for a successful professional life, not a specific roadmap. And certainly on that list in my mind is taking time out every once in a while to think about, where am I going? Is that where I want to go? What will I promise myself I'll get accomplished in the next, say, month, such as getting that paper into a journal? What will I stop doing that clearly doesn't work and I keep doing it anyway? And to do that kind of thinking, it's not going to happen as you're trying to go to sleep at night. It's not going to happen at 2 in the morning when you wake up anxious about how things are going, or during your commute to and from work. It's got to be really calling time out as you would with a child who's gone out of control or perhaps referees who are studying replay to figure out how they can retain control of the game. It's truly time out without phones, without people being able to get at you. Suzanne and I used to do that walking on the beach at the place we have on an island in Wisconsin in the summers. But it has to be something that's relaxing, inaccessible, quiet, and so on. Now, this kind of advice is timeless, but I think it's especially important these days because people have access to you in so many ways, in such volume, that the timeout periods have to be, in some ways, planned, contrived. They won't happen as it would in rural farm country where you were just doing monotonous work out in the fields all day. You can think a lot at that time. So you have to create that opportunity to think about yourself without interruption.
So, thank you, Bob. So I'm going to start with a question, but before I ask my question, I want to give you guys a warning. Yesterday at a really wonderful workshop, I learned a technique called cold calling. And this is where folks who are giving a talk, actually identify folks and ask them questions or ask them to ask questions. So I want each of you to think of a question regarding career advancement, something that you've thought about in the past. So I have that ready. Because once I open it up to the group, if there's any need for additional questions, I may come down there and do some cold calling. So just fair warning. So my first question is for you, Jada. One of your pieces of advice is to take a chance and overcome fear. And I'm curious if you can give an example of when you took a chance or when one of your mentees took a chance and how that worked out for you.
Well, thanks. I've already described a little bit of probably the basis or the root of some of my fears. But I also want to describe, I think it's great at this meeting because my very first formal mentor was Giselle Corby-Smith, who of course won an award at this meeting. And I told you about how I arrived and had this passion around caring for the underserved, and so I came to Grady to do just that. I had some experience with teaching, I had some experience with delivering patient care, the population was what I wanted. I had no idea about other aspects of academic medicine. And so with sort of the gentle support and those of you who know Giselle, the persistent approach of nurturing, she also encouraged me to think about things I had never thought about, such as research, and take a chance to write a grant, take a chance to do a program at UNC for distance general medicine fellowship, to explore other aspects of academic medicine. And while I wrote a fair number of papers and did research and got grants, it was not a central part of my career today, but I was very happy to embrace all those parts of academic medicine and take that chance to learn more about myself and to really learn that with those chances and sort of handling that fear, that I could be successful, even in areas from which I had no prior experience.
Great, thank you. So anyway, I'm going to throw it out to the audience. If you have a question about techniques for advancing your career, this is a great time to get advice from folks who have been quite successful at all stages of their career. Please just raise your hand. We've got folks with roving microphones. Are there any questions out there for the panel? Looks like we've got one here.
Carlos Estrada, University of Alabama at Birmingham. I would love to hear your thoughts, anyone, on how to spot talent. How do you spot talent with a brief interaction, with writing a paper, with anything you do?
Spotting talent. Who wants to start?
Didn't quite understand.
So the question, I believe, was how we spot talent. whether it's clinical or research, teaching? Are there key factors you folks look for in hiring folks or in deciding when to place someone in a leadership position? What is it that helps you to make those decisions?
So I will say now in my leadership role that it's really interesting. I did a leadership development course where they talked about hiring for culture and fit within an organization, and that sometimes we have looked at a resume, so to speak, of whether it's RO1s or grants or papers, that would be a traditional way of defining talent. But that those are things that you can train, as I learned through Giselle. I had no experience in writing papers or writing grants, but really when I look for talent, if you will, or people that I would like to work within our team, I'm thinking about how that person is going to work together collaboratively with our with other faculty. And I think that other things can be developed. Of course, it's helpful if they're a triple or quadruple threat where they have all those qualities in addition to having papers and all those other things. But I think I'm really looking for the individual people and how they work together, because even if they have all the grant-making opportunities and have been successful in the past, but they come and are disruptive or demanding and not working together collegially, it's really difficult. So.
Great. Suzanne?
I think the real question, and at least looking back, is not so much spotting talent. If you're around somebody who's really good, every single person in this room is more than smart enough to figure out this person's really good. The real trick, and I don't have the solution, but is to spot potential that's going to flourish into great talent. Because we're working over and over again with young people who are at a level that not necessarily have shown how good they're going to be. I'm going to give a very personal example, and I don't know if Ann Nattinger is in the room. Ann, are you in the room? While I'm...
Yeah.
Oh,
right
there you are! Well, I'm going to tell a story. When I and Bob did not spot this fantastic potential, early on we were very young directors of a division, and we had the opportunity to hire a new beginner faculty member, and Ann came to visit us. And I thought she was terrific, but I didn't think that she was quite as good as the person we ultimately hired. And were we wrong? So be prepared to fail on that front. And if you're on the receiving end, like Ann, don't worry about it, because you're going to go on to be fabulous anyway.
So, another question from the audience? I see someone in here.
Teresa Chang from Boston Medical Center. I see on one of the advice it says network, network, network. And some of us are not real natural at networking. And I would love to hear a little bit more about how do you do it? How do you embrace it? Because it's not that natural for some of us.
I can talk about
Brita?
So it's not natural for me either. I'm naturally introverted, and so it's not super easy to be out there networking or just meeting people for the sake of meeting people for me. But what I do enjoy is finding people with similar interests, and especially somewhere like SGIM, where there are so many people that are really passionate about what they do and that are really making a difference. That's something that I can really connect with. So for me, networking is really just more, again, about sharing what I'm interested in and then finding other people that are. And slowly, as you do that, you start to meet more and more people. And then I've found great opportunities can come your way. So that's sort of how I've gone about it.
So,
Chris,
another
Chris,
question.
we have a question way.
Oh, right, sure.
Yeah. Hi, good morning. I wanted to actually ask a question, change the direction a little bit and talk about, right now I feel like the field of medicine and what physicians and what clinicians are required to do and our role in the team, a healthcare team, is changing. And I'm sure this is something that's happened at every stage where you are mentoring people who are trying to do careers or pathways that are very different than what you were doing before. And any advice that you have for clinicians that are taking on these new things, such as population health and quality improvement and things that are new and kind of different from traditional roles that physicians play. What advice do you have for these pathways that are still relatively new?
So,
Brita?
yes. So I took on a role as of July to direct population health for our medical group, which is a new position, as you said, and sort of am making it up as I go along. But again, there are other people, other places that have been doing this for longer. So in some ways, I'm reaching out to them to see what best practices have been and seeing what I can adapt to my institution. Of course, each institution or program or clinic is different, and they have their own culture, they have their own way of doing things. So adapting strategies to your local program can be challenging. And also building out your team in order to do that is challenging. And getting the right information is another really key aspect in population health. But I do think the important things to think about are the outcomes, what you want the end goal to be, and then, as Jada was talking about earlier, developing a team of people from multiple disciplines that work well together. And I think with that team approach, with a variety of skills and talents, with the same mission, that group is going to be able to troubleshoot and get to those outcomes that you want.
Bob?
And I think you shouldn't expect that there's somebody out there who knows exactly what you're supposed to be doing and you're way short of that person. Very often these are entirely new career opportunities, and you're making it up as you go along. Why not you instead of somebody else?
Okay, yes.
Harry Selker, Boston. As clinical epidemiologists, you all know that there's a terrible bias represented by you all and by graduation speakers when they say take risks. Because the selection is that the people who took risks and succeeded are up there. The 80 other percent are not on the... Right? You wrote the book on that. So my question to you is really taking risks is being blithe about what happens. Really, it's a bad decision that was made. And that doesn't mean in a pejorative way, but we made a decision that was bad. I wondered if you could talk a little bit about how one dissects a decision which went bad and recognizes that it was a bad decision so you don't keep making that same one.
Wow, that's a great question. You guys have any answers there?
Well, I guess I started out talking a bit about failure, and I don't know, was fortunate or unfortunate to fail early and learn from that. And so one of them was actually trying to get into medical school. I could not get into medical school. I was really interested, I really wanted to do it, but when I had just started college, my usual strategy of going to class and doing my homework and then taking the tests wasn't sufficient. So my grades were not very good my first year. And I learned from that. It took me a while, a lot of trial and error to figure out how I learned best. And from that, I grew and figured it out. And so by the end of college, my grades were better. But when I told my advisor that I wanted to go into medicine, he told me, well, that's not possible. Don't even bother. Don't try. But I did anyway, and I failed. And so it took me 2 more tries and still failing, and then finally getting some help at least to scramble off a wait list to get into school. And so that's an example, I guess, of maybe being persistent, building resilience, and developing the skills that I needed to succeed. There are other types of failures, I think, that are ones where you should perhaps turn away because maybe it wasn't the right thing to do. But in that instance, to me, it was really something that was very important. And so it was more about building the skills in order to make it happen rather than turning to something else.
Yes, Suzanne.
Well, again, it depends how you frame things. But I think if you've always succeeded, then you've failed. Because you're not really moving out beyond your comfort zone. And so I think failure ought to be built into one of your goals. And so go to an area that the risk might be a little greater that you're going to fail. But go to an area that you're passionate about. I mean, don't go out to fail for failing's sake. But and if you think of it that way, I mean, all of us are failing a little bit anyway, a lot of the time. And some of us, all of us probably fail once in a while. It's something very important. And again, for Bob and me, I think one of our big failures ended up being at Annals of Internal Medicine because we accepted a paper from some estrogen people that criticized the drug industry. I'm very proud of that failure. So, but it didn't actually end up defining us. And that's the point. I mean, the biggest job in terms of prestige, in a way you could say, well, gee, we left before we wanted to. We were not fired, we left. We said it's no longer going to work here. And yet the world was hardly closed off to us. And it's been a terrific, I'm so glad we went. I'm so glad we had the opportunity to do this. That doesn't mean we would have done it exactly the way we did do it. We certainly learned better things. But if you haven't failed, there's something wrong with your success.
Yes, thank you.
Early in our careers, I think we're counseled a lot to say yes to things, to take on new roles. And then eventually it becomes people advising you, start saying no, focus your career more. I'm wondering if you could share advice on how you got the wisdom or the courage to know what to let go of, and if you ever regretted saying no to something.
I can't see who said that, but that sounded like one of my faculty, Mara George, but I think I know the voice. But I would say that one of the critical points of my career has been mentorship, which I defined early on in 3 words, which were Giselle Corby-Smith. And later, after she left in her wake a group of faculty that she mentored who met perhaps to just bemoan the fact that she had left our institution, but then actually came together to mentor each other and do a peer mentoring process. 6 of the 7 of whom are actually here at this meeting. So even that peer mentoring process, Anu Pronspay, Stacy Higgins will be here earlier, Bennett Lee, lots of folks. I don't want to leave anyone out. But the point is that early on, I said yes based on Giselle's suggestion to lots of things. I took lots of chances. Even now, I still have mentors. So I have made it to full professor, but I still seek mentorship through one of the deans in the School of Medicine outside my department. I meet with him monthly. My division chief, Ted Johnson, who's here, I still meet with him regularly, ask about decisions. And so to get other feedback to really consider. And then I think about that passion and purpose that I had earlier to sort of help me refine the choices that I make. But I think early on, it's a lot of saying yes because you're trying to explore, take a chance, find out what you really want to do. But then later you're able to take a step back with hopefully the counsel of others to think about what's really important and what might benefit you as you're moving along the path.
So we're getting tight on time. Yes, quickly.
Oh, just that you need to say no to some things in order to make room in your life to say yes to wonderful things that might come your way. This happened when we stepped down as division chiefs. Our dean said, this is going to hurt your career. It's a terrible decision. But all kinds of things were possible with the extra time that we had when we weren't that.
Yes, thank you. Over here. Yes.
Hi, this is April Fitzgerald. I have a question that relates to diversity. So there's all sorts of diversity in personalities and cultural background. And I've heard you talking about looking for individuals who sort of fit the mold or are going to work well with you. The literature suggests when we look for diversity, it actually makes the work environment a little more difficult because we have to sort of figure out how to work together. And I worry when academic institutions look for people who are sort of their mold, that they might be forming a groupthink and just perpetuating the same philosophies along. So I'm wondering how you've worked with that tension between wanting a diverse group of people who may think differently and act differently and have different personalities, but it may make the work environment a little more difficult and you have to figure out how to get people to work together nicely.
Good question.
So,
Well,
thoughts from the group?
I'll start with that. I think you just simply have to embrace it, and that it is not going to be easy, something that may be a challenge, but I think in the long run can be more rewarding. And I know especially literature around gender diversity, but certainly I think in diversity overall can actually, the different voices, the different ideas in the long term can actually help the team be more successful. But it may take some time to hear people's different perspectives and embrace it. So you have to embrace it.
I agree with that, and I think with time, I've learned that actually, obviously when you're trying to make a group work on some project, you're trying to put together a group, there's been an expression several times, and we all do this, to try and find people who can work together. But actually, with time, I've tried to be a little wiser and to find people who can contribute, regardless of whether they can work together, and to figure, and it's my job then, as the leader, to figure out how to get good contributions from people that I don't think are working together with us. And it's my job to figure out what is it that they can contribute, that they want to contribute. And that way you really do get a more diverse group. It's challenging, but very rewarding to see a few years down the road how some of the people who you thought were going to be the most difficult end up being just such wonderful people to work with. And by the way, the same thing happens with patients. Sometimes you have a patient, when you first meet him or her, you think, oh gosh, there's a groan. And a year or two later, they're among your favorites. It's kind of fun.
Yes, here.
I'm Karen Lasser from Boston Medical Center. I have a question for the women on the panel, which is whether you've experienced any gender bias in your career and any strategies you might have to overcome that.
Who wants to
I can start. I honestly can say that I don't recall any, largely because I've worked in practices where both the patients and perhaps the physicians who've chosen to work there are more diverse. You know, I don't, it has been more of a challenge to, especially after Giselle left, to identify people who were senior leaders who I specifically related to in terms of gender and race and other things. But whether I felt that there was specific impediments in my way, there was more of, I had to seek and find my own peer support network, and then understanding the importance of mentorship, actually seek others, you know, to sort of find those opportunities. But I don't think that I had a formal experience where things were put in my way.
I went to medical school at a time when there were 160 people in our class, 8 of whom were women. And I experienced quite a bit of gender bias, but never mean gender bias as a medical student. Medical couples were even rarer than women medical students. And Bob and I, when we applied for residency, almost everybody in our class got within the first 3 of their choices. They were matched within the first 3. We were matched with our 13th choice. And it was a lucky 13. It was Stanford. There were 14 residents, 6 of whom were married to each other. And 4 women, all of whom gave birth in the first 2 years of residency. So early on, then he had to go in the Army, and because it was Vietnam time and he was going to go to Germany, and so I said, well, I'll apply too. And I got back a letter from the Army saying we'd be happy to have you join the Armed Forces Army or medical service as soon as your youngest child turns 18. So yes, I mean, suddenly I was faced with not having any medicine for 3 years at a crucial time in my training. And I finally, after exploring every possibility, called up the office of the Surgeon General of Europe. His secretary assumed I was important because I was calling for an appointment with him and gave me one. And he gave me a job. So that was so important. At that, I have no idea how my whole career would have gone if I'd had to sit out 3 years after 2 years of residency. But there's another kind of bias that happens, or at least happened along in my career, and that is when we came back to the States in the late 70s, early 80s, medicine was looking for women. And all of a sudden, I was being asked to do lots of things much earlier than most men were being asked to do, like being on the ABIM and being in the Institute of Medicine and so forth. So bias works both ways, and I experienced it both.
So thank you. So we are actually out of time. We need to move on. I expect or suspect that we easily could go another 30, 40, 60 minutes with this discussion because there are many questions out there we didn't get to. So maybe next year we'll expand this session even longer. But I really want to thank our panelists for putting together their advice, which you can see on the website, and for being here today.